65% of our children between the ages of 13 to 17 are overweight and 26% are obese. This, according to the Global School Health Survey.
We have to curb this trend. This year, we will seek to table and to launch, this is myself and my colleague Minister of Education and Youth, new policies and laws around food options in our schools through the soon-to-be implemented school nutrition policy to keep our children healthy and over time help them to develop habits around consuming more vegetables, drinking more water as opposed to sugary drinks. The policy proposal has passed through the stages of internal consultation and is to go before Cabinet as a green paper, Madam Speaker. Madam Speaker, we will work to guide and mandate, in some cases, our school cafeterias to prepare healthier options for our children. We must help our children to develop healthier habits, and the school environment, Madam Speaker, is the best place to start.
While noting that there were challenges with the sugary drink restrictions in schools due to the disruption of face-to-face learning, Minister Tufton assured the public that this is a priority, as well as programs will be happening to get children more active.
There is an inspection that is now taking place by the parish health offices among all schools. The Minister and I are involved in that process, and once that is completed, we will again resume strict instructions and enforcement around ensuring that the sugary drink restrictions in schools are maintained, are established and maintained, Madam Speaker, and that's a commitment that we are making here today. Additionally, now that schools are reopened, we will also see another collaboration with the Ministry of Education and Youth, which is the rollout of the Jamaica Moves in Schools program to get our children active as part of their wellness program. The Minister of State in the Ministry of Health and Wellness, the Honorable Juliet Cuthbert-Flynn, will lead this initiative, and there is nobody who can lead this initiative better than her.